Welcome back. In today's lesson, I will discuss about Raynaud's phenomena. First, we should have to know the difference between primary Raynaud's or Raynaud's disease and secondary Raynaud's or Raynaud's phenomena. Primary Raynaud's or Raynaud disease is episodic color change evoked by cold or emotion. And secondary Raynaud's or Raynaud's phenomena is also the same. But the main difference is in Raynaud's, which is primary one or Raynaud's disease, patient is not known to have conditions that cause Raynaud's or the cause is idiopathic. Whereas in Raynaud's phenomena, it is secondary. So there is a condition that is known that causes the problem. In primary Raynaud's or Raynaud's disease, no digital scars or gangrene. Investigations such as ESR, anti-nuclear antibodies, and such alike things are normal. Whereas in Raynaud's phenomena or secondary Raynaud's, ESR is abnormal, anti-nuclear antibody can be positive, and there is a nail fold change after capillaroscopy, and there can be digital scars or gangrene. Raynaud's phenomena refers to the classic triphasic sequence of blanching or pallor, cyanosis, and erythema of the digits induced by cold exposure and emotional stress. The color change are brought by first initial arterial vasoconstriction resulting in hypoperfusion and pallor, then venous stasis occurs, which causes cyanosis, and as the last, reflex vasodilation caused by nitric oxide production causes return of blood flow to the area and appearance of erythema or ischemic appearance. So first, fingers become white due to lack of blood, as you see on the image. Then fingers turn blue as vessels dilate to keep blood in tissue. Then fingers finally turn red as blood flow returns. The color change is classically reproduced by immersing the hands in iced water and reversed by warming. During the blanching phase, there is inadequate tissue perfusion of the affected area associated with pain and paresthesia and resulting in ischemic damage only when associated with rheumatic disease. The blanching usually affects the distal fingers but may also involve thumbs, toes, ears, and the tip of the nose. The affected area is usually well demarcated and uniformly white, and digital ulcers associated with rheumatoid phenomena are indicative of underlying rheumatic disease. Raynaud's disease often begins in adolescence and it's characterized by symmetric occurrence, unlike that of Raynaud's phenomena, which is asymmetric. And also in Raynaud's disease, there is absence of tissue necrosis and gangrene, whereas in Raynaud's phenomena, there is tissue necrosis and gangrene and lack of manifestation of underlying rheumatic disease. And children have normal nail fold capillaries and absence of periangal telangiectasia. So, as I have said, in rheumatoid disease or in the primary one, underlying disease is not known and it is mostly common in females or female predominance is seen, whereas in Raynaud phenomena, the underlying disease or the underlying cause is known and it affects both genders equally. Rheumatoid phenomena should be distinguished from acrocyanosis and chilblains. Acrocyanosis is vasospastic disorder resulting in cool, painless, bluish discoloration in hands and sometimes feet despite normal tissue perfusion. It might be exacerbated by stimulant medications used to treat attention deficit disorder. Whereas chilblains is a condition with episodic color change and the development of nodules related to severe cold exposure and spasm-induced vessel and tissue damage. And this is associated with SLE. Regarding investigations, most of the time, Raynaud's phenomena is diagnosed clinically, but sometimes we should have to do full blood count, organ function test to rule out disease such as chronic renal disease, and also we should have to rule out other connective tissue disease by doing ESR, plasma viscosity, rheumatoid antibody, antinuclear antibody, and also we should have to rule out hypothyroidism by doing thyroid function test. Duplex ultrasound or arterography might be indicated if suspicion of arterial disease exists. This differentiates primary and secondary rheumatoids, and also it elucidates the underlying disease. Regarding treatment of Raynaud phenomena, the treatment begins with avoiding cold stimuli, use hand and foot warmers, and avoiding carrying bags by their handles, which impairs circulation. Sometimes nifedipine can be used to reduce the symptoms, but does not limit the number and severity of the episodes. But as you know, nifedipine has some side effects such as headache, flashing, and hypotension because of the certain hypertensive effect. Topical nitrate may result in digital vasodilation and may reduce the severity of an episode. And also, stopping some behaviors such as smoking, caffeine, and other medications that precipitate the condition should be encouraged. Thank you for watching. Have a nice time.